Hidden within every stride, twist, and lift lies the pelvis, a small but mighty engine that anchors the spine to the legs. Two tiny joints, the sacroiliac and pubic symphysis, silently transfer force and keep us balanced. A runner with groin pain or a new mother struggling to walk often discovers that the problem isn't the hip or back at all. It's these overlooked joints that hold the key to motion and stability.
The pelvis isn't just bone. It's a living ring of strength and grace. The sacrum locks between the hip bones like a keystone, distributing weight through the body. The ilium, ischium, and pubis fuse into a perfect basin, strong, stable, and subtly flexible. Evolution refined this form, broader in women for childbirth, narrower in men for power. And when one point falters, the whole ring feels the strain.
The sacroiliac joint is built for balance, part synovial, part fibrous, allowing tiny tilts that absorb every step. These minute shifts, nutation and counter-nutation, keep motion smooth and load transfer efficient. At the front, the pubic symphysis binds the ring together. Normally still, it loosens slightly in pregnancy, allowing flexibility for childbirth, but sometimes causing pain if the support system falters.
Like a suspension bridge, the pelvis holds through tension. The posterior sacroiliac and interosseous ligaments resist vertical shear. The sacrotuberous and sacrospinous prevent the sacrum from tilting. The iliolumbar ligament ties the spine to the pelvis, anchoring posture. Together, these create form closure, the fit of the bones, and force closure, the pull of muscles and fascia. Stability is never static, it's a living tension between structure and strength. Each step begins as force flows from spine to sacrum to leg. One side of the sacrum tilts forward, the other back, a rhythm of nutation and counter-nutation. In lifting, these motions lock the pelvis. In childbirth, they open it. But when the rhythm breaks, through leg length differences, poor posture, or fatigue, stress spreads across the ring, turning subtle shifts into pain.
Life constantly reshapes the pelvis. In pregnancy, relaxin softens ligaments for delivery. Athletes push the ring to its limits, runners with shear, footballers with twists, dancers with extreme flexion. Over time, aging stiffens joints, trading mobility for stability. And in hypermobile bodies, excess laxity demands control through strength and awareness. The pelvis evolves with every stage of life, adapting, compensating, surviving.
Pelvic pain is a trickster. Nerves from L4 to S3 overlap so deeply that pain from one joint can echo across the hip, back, or groin. SIJ pain often mimics sciatica. Pubic pain can feel like a muscle strain. True diagnosis demands careful patterns. Pain rising from sitting, tenderness near the PSIS, or discomfort on single-leg stance. Yet when symptoms grow severe or systemic, deeper causes like infection or trauma must be ruled out.
Sacroiliac dysfunction may show as a dull ache on one side, pain climbing stairs, or stiffness after sitting. Athletes may feel sharp groin pain from inflamed pubic symphysis. Postpartum mothers can sense a subtle click, a mild diastasis at the joint's front. Even the coccyx, if misaligned, can throw the whole ring off balance. Each story teaches that pelvic pain is rarely where it seems.
Diagnosis begins with listening. History reveals load, posture, trauma, or pregnancy stress. Clinicians use test clusters, FABER, thigh thrust, Gienslands, to confirm the SIJ, squeeze or palpation for the pubic symphysis. Imaging refines, not defines the story. MRI or ultrasound only add clarity when matched with motion and pain patterns. True assessment lies in seeing how the pelvis moves, not just how it looks.
Healing the pelvis begins with restoring its dialogue, structure, muscle, and mind working together again. The first step is awareness, learning how posture, breath, and core alignment reconnect the ring. Subtle stabilization exercises, focused breathing, and gentle movements retrain deep stabilizers, the multifidus, transversus abdominis, and pelvic floor, to share the load evenly. Real recovery isn't about rigid strength, it's about fluid control. Once pain subsides, movement becomes medicine. Controlled walking, bridge variations, and hip mobility drills teach the body to re-coordinate motion. The goal is symmetry, balancing left and right, front and back. Yoga and Pilates, when guided with precision, restore grace and control. Over time, micro-movements become full, confident strides, the pelvis learning again to carry life's rhythm with strength and ease. For athletes, the pelvis is a powerhouse. Every sprint, kick, or twist depends on how efficiently forces pass through it. Small asymmetries can rob speed or trigger pain. Targeted strength for the glutes, adductors, and deep core enhances transfer and control. Smart training doesn't just build muscle, it calibrates mechanics, ensuring the pelvis channels energy rather than absorbs strain.
After childbirth, the pelvis must heal from one of nature's most remarkable transformations. Ligaments that softened for delivery now need time to regain tone. Gentle pelvic floor retraining, posture correction, and rest form the foundation. Compassion matters. Pushing too soon delays healing, but patient awareness rebuilds balance. A mother's recovery is not a return to the old self, it's the rise of new strength.
Time changes the pelvis quietly. Cartilage thins, joints stiffen, and movement patterns narrow. Yet, with mindful activity, walking, stretching, and core maintenance, flexibility and stability can coexist even in age. The goal shifts from performance to preservation, moving not faster but longer. Strength may fade, but intelligent motion keeps the rhythm alive.
Prevention is awareness in motion. Sit tall, move often, lift smart, breathe deep, the small choices that protect the pelvis every day. Balanced ergonomics at work, proper footwear, and conscious walking patterns keep the ring aligned. The body speaks softly before it shouts. Listening early is the real key to lifelong pelvic health. The pelvis isn't just anatomy, it's emotion, motion, and foundation intertwined. Stress, tension, even fear can lock its muscles and mute its rhythm. True health comes when movement feels effortless again, when breath, balance, and emotion align. The pelvis doesn't just support life, it reflects it. Every step we take begins here, where structure meets soul.